Standard precautions are used for the care of all patients. They are designed to reduce the risk of transmission of microorganisms. They apply to blood, all bodily fluids, secretions, and excretions, excluding sweat, non-intact skin, and mucous membranes. When caring for patients with HIV or AIDS, only standard precautions are required.
Hands must be washed with soap and water when visibly dirty or soiled with blood or other body fluids. If hands are not visibly soiled, hands can be cleansed with an alcohol-based hand rub or soap and water. Hands must always be cleansed before entering a room, having direct contact with patients, donning sterile gloves, and moving from a contaminated body site to a clean body site when caring for a patient. Hands must be cleansed upon leaving a patient's room, after contact with the patient's intact skin, bodily fluids, mucous membranes, non-intact skin, wound dressings, and after removing gloves. A gown should be worn to protect skin and prevent soiling of clothing during procedures that are likely to generate splashes of bodily fluids. Mask and eye protection or a face shield should be worn when splashes or sprays of bodily fluids, excretions, or secretions are anticipated. Gloves are worn when touching any bodily fluid or contaminated items such as blood or secretions.
Removing PPE is done in the following order. First with gloves, second with goggles, third, take off the gown, and fourth, remove the mask.
Additionally, the environment needs to be cleaned between patients to prevent spread of microorganisms. Linens need to be transferred in a way that avoids transfer of microorganisms. Sharps need to be disposed in a sharps container, and needles should never be recapped.
Droplet contact and airborne precautions are used alone or in combination for patients with various illnesses. These patients should always be placed in a private room or in a room with another patient with the same active illness.
Droplet precautions are used when transmission of large particle droplets is anticipated. Large particle droplets can be transmitted through mucous membranes, the conjunctivae, coughing, or sneezing. The droplets do not travel more than 3 feet and do not remain suspended in the air. With droplet precautions, a mask must be worn when working within 3 feet of a patient. Logistically, hospitals often require a mask upon entering the patient's room. Some diseases that use droplet precautions are pneumonia, influenza, whooping cough, and bacterial meningitis.
Contact transmission involves physical transfer of microorganisms by skin-to-skin contact or by touching a contaminated object.
In addition to standard precautions, a gown and glove are to be worn when entering the patient's room.
Some diseases in which contact precautions are necessary are VRE, C. diff, and RSV.
Airborne transmission occurs by spread of airborne droplets or dust particles containing the infectious agent. These microorganisms can be spread widely by air currents. Special ventilation is required to prevent this transmission. The patient must be placed in a negative airflow room with 6 to 12 air changes per hour and high efficiency filtration of air. The door needs to remain closed. In addition to standard precautions, an N95 respirator should be worn when entering the patient's room. Some diseases in which airborne precautions are necessary are tuberculosis, rubeola, and chickenpox.